Good evening. I'm Parker Prescott. I'm a member of the congregation here at the Unitarian Universalist Church of Manchester. And I'm a member of the Social Responsibility Committee. And we are very happy to host and sponsor this event with Granite State Organizing, whom you may hear referred to tonight as GSOP. So welcome to the Unitarian Universalist Church of Manchester. Paraphrase Dr. Martin Luther King Jr., we are all here tonight on some very important business. So first, some essential housekeeping. Bathrooms, there's a men's room through the double door here on this floor, straight back on the left. There's a women's room on the second floor if you go up the stairs to where you entered, and then go up another flight of stairs. It's down the hall on the left, and the two door leaders will assist you with further direction. And emergency exits are through the double doors and upstairs where you came in, and to my right, following the exit signs upstairs and out. And there's a bathroom that is handicapped accessible through this door and to the right. Our Reverend Kelly is expected to provide a welcome tonight, meditation, reflection, and our usual lighting of the chalice. Unfortunately, she is under the weather and unable to attend. I think her spirit is in the pipes. Just a few words that I'm sure she would like to have expressed. The Unitarian Universalist Church of Manchester strives to be a place of spiritual faith and hope, welcoming to all who wish to participate and to be a vital part of our city as a congregation of concerned and engaged citizens working for a better, healthier, and more equitable community for all of us. Stephen Sondheim wrote a musical about a theater troupe that found itself having to pull together a full musical production in just 2 weeks. For everyone who worked to make this happen tonight, I'm sure we all feel a little bit like that theater troupe. And now I'd like to introduce one of our own troupe, Maddie August from Granite State Organizing.
My name is Maddie August, and I work as a volunteer with Granite State Organizing Project. GSOP is New Hampshire's largest faith-based grassroots community organization. We consider food security, safe and affordable housing, quality child care, education, and health care to be basic human rights. Towards the goal of safe housing, I'm so glad that everybody is here. It's a small group, but you know how we start. And Bill, we're so glad you're here. Small or large, and maybe we'll do it again in the spring when it's a little warmer and we'll invite you to come on out. But I'm so glad everybody's here to learn more about this important topic of lead paint contamination and how we can keep our children and community safe. We're very grateful to Phil Alexakos from the Manchester Department of Health. He's here to provide information about lead paint and its dangers and options for health and improvement. Phil is passionate about this topic, and we are lucky to have somebody here in Manchester who is both knowledgeable and cares so deeply about its residents. Before Phil steps up to talk, let's just take a few moments to introduce each other at our tables, and I'm almost wondering, the group is so small we could just concentrate. I thought we would just talk amongst ourselves, but maybe we could just introduce ourselves to the group if you want to. If we're comfortable doing that, and maybe say a word or two about why we're here. So we have maybe more volunteers than civilians here. Judy, do you want to start?
Sure. Jane Christiani, resident of Ward 1. And really just here because this is such an important topic, and it was nice to be on the board when Alderman Ferrero brought the concept of a lead commission to us and be able to start this work in Manchester.
Christine Fajardo, I am the Alderman in Ward 4 and also a concerned resident. And very happy to, I think you summed it up perfectly. We are very lucky to have you, Phil, and it's been a whole bunch of people contributing to the formation of a commission to look at this more closely. So it's great that you're here, willing to host us and help us get the word out. And yeah, thank you.
Eliana?
Yeah. So, hi everyone, my name is Eliana Moretto, and I am the Latino Community Coordinator for the Granite State Organizing Project. And I am here because this is something that I clearly care about and also support my colleague Viola and obviously volunteers and our community, but it's also, deeply impacted. So her name is Alina. And she's very grateful to be participating in this meeting so she can actually gain some knowledge about pretty much that.
My name is Elizabeth. I am happy. Estoy feliz de estar acá.
She's really thankful and happy to be here,
Aprendiendo de muchas cosas.
learning about a lot of different things.
Y lo importante es que también los incluyen a nosotros como los hispanos.
And it's very important, and she's thankful that they include us even as Latinos.
Para Dios somos todos iguales.
And in God's eyes, we're all equal.
Thank you.
I'm Travis Audette, a member of the Manchester UU Church here, and also a volunteer, but mostly very interested in the topic and really looking forward to Phil and Mr. Chair.
I'm Jackie Spinard, belong to the Unitarian Universalist Church. I knew just a few years ago about a child that was identified with lead poisoning, and I was very upset. And I thought the inspector had made a mistake, and then I found out they don't inspect for that, and that made me really mad. And I also taught special ed children at Northwest Elementary, west side of Manchester, for 28 years, and I can imagine that of all those children I taught, that some of them were affected by lead, and it's upsetting that it's permanent and affecting them now as children and as adults. We've got to do something. Thank you.
I'm Angela Audette. I'm also a member here, and here just as a concerned citizen and a sort of newish resident of the Manchester area, along with Travis here. And so getting to know an issue in my country.
Judy Corbett, and I'm here primarily because I'm a church member to welcome you, but I'm interested in this subject and have been aware for a long time, but not so much on a local level, so can get up to date.
I'm Dave Corbett, and I'm a member of the area church here, doing some kitchen work tonight, but this is such an incredibly important subject, and it's a problem throughout the country, and maybe throughout the world, but certainly our country. So, very important to deal with it.
I'm Edna White. I'm also from this church. I don't know how many years ago it is now, probably about 12. And I worked at the International Institute. There was actually a little girl that died of lead poisoning. And the landlord, in that particular instance, tried to cover it up by asking if we could reduce the number of people on the fuel assistance
King, and I'm also a member of the church here. And I'm here because I'm interested in this topic. We've been talking about this topic for decades, and so I'm interested in why we're still talking about it and what we can do about it. So thank you for bringing this up.
I'm Marge Fitzgerald, also a member of the church, and volunteer, and interested in learning more. I think that I always thought that there were regulations and things about remediation, and now I'm hearing that there are not. It's very horrifying. So I want to hear more.
I'm Penny Hussey, a member of the church. I also worked for 27 years doing home visits around Manchester with babies with special needs, so I'm familiar with families who dealt with lead and children who had resulting issues.
Baila Katsume, I'm the Deputy Director of GSOP, and as a mother of a 2-year-old, this issue touches my heart, knowing that there are kids out there in our city who are being poisoned by this, but there's also efforts that are happening, so I just want to get as much information that I can distribute to our communities, and this is reorganizing, so thank you all for being here.
I usually don't need the microphone. Can everyone hear me okay? I'm using my referee voice. Yo soy un árbitro de fútbol. So and my group didn't bring my whistle, so we'll leave that alone. So welcome everybody. It's a pleasure to be out here talking about an important issue in person. And I hope that this is one of many opportunities that we have to get together to talk about important issues, starting with lead poisoning prevention. And one of my goals tonight is to find champions and advocates that we can bring to our table to discuss how we can improve, this issue and protect kids and families. I have some pictures and some slides, and I know the print is pretty small on some of these, but ultimately, I'm going to try to speak slowly because we have Ileana providing translation, and if I'm going too fast, just give me a little wave and I'll be happy to slow down. Sometimes I can go quickly. Lead has been around as long as we've been around, but it's been known for a very long time that it's toxic, and the body has no use for lead. So any amount of lead is harmful, and that's one of the things that some people aren't aware of, is that any amount of lead is harmful, and it can cause, as someone said before, permanent damage. So once someone is exposed to lead, and we're very concerned when young children, pregnant women, and developing fetuses are exposed to lead, because the damage that happens can be with you for your entire life. And someone else had shared their experience, and I thank everybody for their candid experience sharing, that other effects, whether it's having difficulties in school or behavior, are impactful to everyone. Families, schools, a lot of the community agencies that do a lot of great work. This issue touches everybody. So it's an issue for society to be more aware of, and hopefully we can get folks passionate about making important changes. Unfortunately, I also was here in 2000. I've been with the health department since 1994, and I was involved in the Sunday ABEC. That was the little 2-year-old girl's name, and it's difficult to talk about because I spent time up in Dartmouth, up in Lebanon, talking to Sunday's mom with the use of a translator to ask questions about how this could have happened. And we talked and we got information about baby formula and what types of cooking equipment and utensils, and we went through a lot of different possible sources of lead, but it really boiled down to lead-based paint. And I'm going to show some pictures to kind of help acclimate you to, what it might look like, but it's not always apparent. But there are some things that we can visually see that should raise a red flag for people to be extra concerned, and I'll get into that a little bit later. But to provide a little extra context, and this will be helpful as we talk about testing. As I mentioned before, any amount of lead is toxic, and our laboratories can only even detect lead down to a small amount, but we use the number 3 and the number 5 as two very important levels, which indicate potential damage and having the enforcement happen, meaning the state comes down to do an investigation and have the property owner make corrections. When I started, the number where we had the state come down was 20. And before that, it was even higher. And so that is something that we've been able to do, is lower that level for action. So I would consider that, I'm not going to call it a success, but it's an improvement. And we do a lot of things when children are tested. We do some home visiting, we notify people of resources, but we're in the prevention business, and waiting until children are poisoned from testing is helpful, but ultimately we want to eliminate all of the hazards before people are impacted, and often for life. So this is a picture of the 3-family on Bridge Street, where Sunday Abeck lived with her family for just a few weeks. And this is the porch where the children played, in addition to some other areas. And zooming in here, you can see this pattern, and it looks like alligator skin. So this is on the deck surface. You can see that this pintura desconcava is broken, and this is hazardous because those pieces could easily be put into the mouth, and that is very serious. This is inside of the window, por la ventana, and you can see the same paint, and it's loose, it's chipping, and there's polvo. When you open and close the windows, it makes a dust, and it's very small, and it gets on everything. Toys, hands, floor, and you can't see it very well, but it is very harmful. So there are lots of things that we want, and the number one thing is to make sure that the paint in our homes is in good condition. That is the best thing that we can do. So if you see conditions like this, that is an issue, and we can certainly talk about what to do about that afterwards during the question and answer. So why is this a big issue in Manchester? And the main issue is we have relatively old housing. When my relatives were working in the mills in communities like Lowell, that's where my Greek relatives are from, these buildings, a lot of housing was needed, and in the paint, to make it strong, was lead. The problem is, over time, that strength breaks down, and then the paint starts to chip and flake, and then we have hazards. So it's very important to know that this paint has been used for a very long time, and in the United States, it could be used until 1978. That is a very long use, and that is why a lot of our housing has some lead in it, because those buildings and those apartments were built before 1978, and in a lot of cases, 1950. So this little chart, just to know, is that the darker the colors, the more of the housing that was built before 1950. And so the darker blue is 83% of the housing units, and these are census tracts in Manchester. You know, it equates to about 18,000 units were built before 1950. Now, some of those units have had lead work done and abatement. Some of them have not. And so the most important thing is to make sure that the paint is in good condition, which makes the hazard as low as it can be. To go in and say we need to remove all of the lead right now is impossible for many reasons. Cost, the people that are qualified to do the work. So the best thing we can do is if we see paint that is not in good condition, that we make sure that we report that and that we do any sort of fixing or repairs in a safe manner. So we have old housing stock. So does Laconia. So does Franklin. So does Claremont. So does Lewiston. They're mill towns. That's why our communities in the Northeast, which are older, tend to have more potential for lead poisoning. Communities in the western part of the country and in newer developments, not so much. So we really have to know our community. And each of these is, as I said before, a census tract. It helps give us an idea of areas that we should be doing more outreach, more education, and these are some things that we'd like to do more of sessions like this. So, as I mentioned before, this is the number of children in Manchester with a 5 or higher, and from 2016 to 2020, anywhere from 80 to 110 children may have a level at 5. That's significant. Now, if you look at, if you like data, when the pandemic started, our ability to do regular doctor visits went down, and our number of screenings or lead testing went down. So you might look at something in 2020, 2021, and even 2022 and say, oh, it looks like there's less cases of lead poisoning. Well, there was also a lot less testing. And so part of our job is to make sure that every child age 1 and 2 have a lead blood test. And there are 2 different ways to be tested. One is called a capillary test or a finger poke, and that is relatively straightforward, except for the last year and a half, the test has not been working because it is recalled. So that was another thing that was working against us. The other method is a venous test. So that is like going to donate blood and they will draw the blood out. Now that's a lot more difficult to do. So the best thing is when someone comes to the doctors that they get the finger test, and then if that is high, then we do the blood venous test. So we start with something that isn't too bad, and then we do something a little more technical, and that is where we report these numbers out. So there's 2 different tests, the finger test and then the blood draw from the veins. And just wanted to make sure people were aware of that for your own children or for grandchildren. The recommendation is age 1 and age 2. And if you have a child that is really advanced and is crawling around and walking before age 1, then it's prudent to have the blood test as soon as that behavior starts. So you don't have to wait until 1 if your child is very active. Now, this is not a great drawing, but I want to point out that we have the ability to look at neighborhoods by census tract and figure out what are the risks, what are the hazards, what are the positive things that are happening in these areas. And we already know where the older housing is, but we also look at things like limited English proficiency. We look at things like people of color and lower income and other factors that make it more challenging for access to healthcare or able to get affordable housing and things that could get in the way of equitable distribution of health. And so we are able to look and splice into these neighborhoods and figure out what strategies might we need to do to get the message to people in a way that can be informative, culturally competent, but also to allow for people to take action. So we can look at a whole host of different factors now, and as you can see, there are a lot of overlay between our maps. And so these are areas that we can work, and this is a great example where, as you're hearing this information, you're probably thinking, well, I know some of these areas in Manchester, and I know some community organizations that would want to hear about this. How do we get the message out, and how do we get people energized to make some changes and improve health? So keep that in mind. And my last slide will be how do we, how do we get together and do more? So I'm going to go past these. This is some data from 2022. This is the most current data that we have. And we're doing a better job testing now that the pandemic is taking a different shape. So we're really making sure that kids are getting access to care and they're getting screened. But remember, we want to make sure that we do things that prevent kids from getting poisoned in the first place. And you can see that we can break it down by age, but we need to make sure that our kiddos are getting tested at age 1 and age 2. And that's something that should happen at their medical home, so at their doctor's office. And if someone does not have a medical home, at the health department, we have a team of amazing community health workers. And one of their responsibilities and main jobs is to help people navigate systems. And one of those systems would be insurance, but also how to gain access to healthcare. And whether that's needing vaccines to go to school, or getting some screening tests, or getting them into their primary medical home, that is one of our functions. So that is something that if you know folks that are struggling with access to healthcare, our health department does a lot of work in that area. So I'm just going to summarize. In around 2022, a group of concerned citizens and advocacy groups, and notably it was the NAACP Environmental Justice Committee, the Conservation Law Foundation, GSOP, our wonderful aldermen that were part of this mission to take a look at lead poisoning as an issue that persists and that we should be doing more about. And remember, this is a preventable condition, and we should always be looking to do better. We've made a lot of improvements. You probably have read about testing water for lead, and all of this is helpful, but there's more that can be done, and we should continue to look and do better. So what happened after this group got together and started talking about the issue on the tail end of COVID? So we were able to pass collectively, because this is always a group effort, the ability in ordinance to have a lead poisoning prevention commission. And this is an important step forward. This is in the law that we are going to put this group together. And you're probably wondering who's in the group. It's not a magical group of people that meet and nobody ever knows, like the Wizard of Oz. They're off and about and doing their thing. It needs to be a balanced group of community members, advocates, health professionals, school professionals, property owners, and most importantly, people who have been impacted by lead poisoning in their life. And often those are some of the most powerful voices, because who wants to hear some government person talking about stuff? we want to hear from the people. We want to hear from, personal stories, and we've heard some of them here tonight, because that's what moves hearts and minds and gets us to a better place. My job is to take all of the information and frame the message so the people making decisions have all of the information they need, but it's really the voice of the community that resonates the most. And so we have a draft list of different types of folks that we want to have on this committee, but I'm hoping that some of you are very interested. And I have a sheet that if you're happy or willing and able to sign, if you have interest in possibly being on this commission or continuing to be part of the discussion, we want to be able to bring some folks forward for consideration as we move along. So I have a sheet. This is what it looks like. I hope that this is just a really small slice, because they told me I only had 20 minutes. And that is really hard, because I could go on and talk about a lot of different details about what I'd like to do, what we should be doing, what we could be doing. But it's not just what I think, it's what we all will be working toward moving forward. And this is, like I said, one step in a much bigger direction of getting folks energized about this important issue. So I am going to put that screen off, and I believe the next part of the session will be some more discussion and then some question and answer, and I'm happy to stay as late as my wife will allow. And when I start getting texts like, where are you? Is everything okay? It's okay, I'm in a good place, I'm with good people, I'll be home, I promise. It's important, but I feel very strongly, and there's not a day that goes by when I don't think about the Sunday ABAC case and what are the things that we can still be doing to keep kids safe, because the impacts are significant, and we need to do everything we can to give every child the best opportunity to be their best selves. And this is something that we should be paying attention to and doing more of in the realm of protecting children. So I thank you for listening, but I want to definitely hear some of your thoughts, and happy to answer questions and get into more detail, either group or if you're shy, which I really doubt it. I think this is obviously a very passionate group, and I applaud your advocacy. I'm happy to have the discussion offline if you'd like. So I will.
I'm thinking that we were going to have a question and answer and also a little moment to stretch and have people reflect, but I'm almost wondering, it's kind of a small, cozy group, maybe we could just get a little closer
Sure,
together.
I'll pull my chair up. I'll start. I'll lead by example.
Just everybody could sort of talk together and ask questions. But if you want to take a moment to stretch, and the UU Church Kitchen Group did an amazing job,
Yes.
Lots of goodies. All right, I think we'll bring everybody back. Hope you've got a cookie or a piece of this blueberry bread. That's brilliant. Bill, thank you.
I expect a different chair. So I have my notepad, so I can make sure that if there's something that I can't answer off the top of my head, then I will write it down, and then, you good? And then I have my sign-up sheet that if you're interested in getting more information, I can send you a copy of the presentation as well. I'm more than happy to do that. In fact, I'm more than happy to send that out. I can send it out to you, and you can send it out to people. But I'd like to just have a question and answer, because there's so many different components to this, from rules and regulations to what are you doing, what is the commission, has it started, what is the goal. All of that stuff is fair game. And like I said, if there's something that I'm not sure of, I will say that and get back to you. But I don't know if we have a...
Should we start with her question about her son's house? And
Yep.
about whether or not the health, A department can come and take a look.
Okay. So-
Yeah, so, her house, her son owns a house.
Okay.
And the porch is like, it's been there like for over 100 years.
Mhm.
So she's saying that, could there be potentially, lead?
Yeah.
And that the porch is also getting into that looking kind of like grainy, hocked out kind of skin.
Yeah.
So she is like a little bit concerned of,
Yeah.
hey, could be potentially that poisoning in there.
Yeah.
And if so, can the city come in and there's a way to check? And if it does test positive for lead, is there any way for any type of assistance to like be able to cover the expenses of helping him as the homeowner be able to actually fix it?
And is the testing free?
So there, yeah, a couple of points, and I'm glad you mentioned testing. They sell, and this is an important thing for everyone to hear, they sell these little kits at hardware stores or Home Depot, Lowe's. That's not like an endorsement, just for the record. And what you do is you take some of the paint and you scrape it off, and you usually put it into a little liquid and it turns a color. But you have to be very careful, and we're having a discussion. If somebody maintains their paint and it's always in good condition, and they put a lot of layers on top, like latex, if you scrape the first couple layers, you're not going to get what's really there underneath that. So you really, when you scrape, you have to get down to the wood, and then you can put it in the test. We use the idea that if your house was built before 1978, you should assume that it is lead. And the other piece is there are certain professionals that are trained to do safe lead repair work. It's called RRP, and I can send some of this to you, Ileana, afterward if that's helpful. That will do the work in a way that doesn't create a problem. And that is something that no matter if it's a house on the north end or any part of the city, if you have an older home and you're doing your own repairs and scraping and causing dust, you could make the situation a lot worse. And people have unfortunately poisoned their own children trying to do a renovation. The city does have a grant program through planning and community development, and so they will provide, usually it's like a loan that's low interest or no interest, and they have other funds that can help, and I can get you in touch with the person, Chelsea Pinsino, to talk about how you qualify. And then there's a list of professionals that are trained that the state maintains. So if someone says, oh, I can fix that for you, and I can and they're not properly trained, then that is far worse than whatever the condition is now. But it's good to be aware of that, and hopefully, if people are watching this and they saw the pictures and they're thinking, I live in a really older home, and this one area, the paint isn't in good shape, what you can do now is just make sure that you obviously, keep people away from it, but knowing that you can track things into the house, that's an important piece of it. So putting a mat down on top of it or something to cover that area is one thing you can do short term. But I'm happy to provide some of that information so that you can share that if that's helpful. Because there's a lot of like pieces, but I want to make sure that you have the information about safe lead work. And I did leave a couple of brochures up at the table that talk about some of those safe practices. Because the last thing anybody wants to do is do something to harm their own family and think that they're doing something, doing it, improving the situation.
Somebody does their own remediation.
Yep.
What are the circumstances or rules or regulations around disposal of the
material is? Or
So that's an excellent question that has come up before. This is gonna sound horrible, but it is not treated as regulated waste. I don't have a good answer for that. It's gonna go to the landfill. It's not treated as hazardous waste, and, it's not in that category, even though, we know that it's lead containing. Unlike asbestos, which is, I don't make the rules, I just know enough to be dangerous. But yeah, it's treated as regular household construction debris.
Why is it's not really an issue for children over 2, like, say a family.
Over 6.
Over 6.
Yeah.
So, is it because of brain development, what is going on, like with the 7 or 6-year-old?
Thank you for clarifying that. The testing thresholds are age 1 and 2 because we want to, again, not optimal, but we want to identify any elevations as early as possible. And if there is an elevation, we can do something so that it's not a chronic, persistent, exposure. The thing about lead is it persists, and for really high cases, it can actually be absorbed into the bone and then be released later and continue to cause damage. But basically what lead does is it substitutes for iron and calcium in bone development and the blood supply, and then it can cause neurologic damage. That's why, during, fetal development through age 6, when things have connected, does that mean that there still can't be damage? No, but that's just the threshold, and that's pretty consistent across the country, unlike, some regulations. That doesn't mean that adults can't be poisoned. There are a lot of professions, including construction work, metal work, some automotive work, sandblasting, where they're actually required to get a lead test. These are adults. And one really important thing is if your family members do work in those fields, they could bring the lead dust home and cause a hazard when you live in a home that is 1980. So I'll say that one more time. If a family member works in construction, automotive, works with metals, certain hobbies, even some ceramics, they can bring the dust home on their clothing. So if they come right from work, they really should take those clothes off before they come in, just to be certain, because we have had children that, because we try to screen every child at 1 and 2 that live in really new houses, but their lead levels are high. And what we do is we will have one of our nurses go out to the home, do an environmental assessment looking at paint, but we also talk about things like, I mentioned before, some cooking equipment, some pottery, different hobbies. Often people may come into contact with lead. Some dietary supplements, which are very much unregulated, but a lot of different cultural herbal medicines and things of that nature can also have lead, especially if they're imported from other countries, and we have seen that. So we have a very long list of questions that we ask folks because we're trying to figure out, is this the home environment? Is it a hobby? Is it somewhere where the child goes 2 days a week for childcare? And I think a lot of you have seen, unfortunately, in a applesauce product most recently, lead found in food items. So unfortunately, we're always asking questions, and the more that it's not obvious, we really kind of start really casting a wide net. But in most cases, it boils down to the home environment, whether it's the paint, sometimes the soil around the house could be contaminated. Very seldom is it the water, but little bits in the water could contribute to the overall amount of lead that a child has been exposed to. And sometimes it's these remedies and other supplements and sometimes some herbal medicines that have been found. And when we hear about those, we try to get that message out to the community. You know, we use the International Institute if there's a particular, you know, certain practice that we may be made aware of that could impact, you know, one culture versus another. We want to make sure we get that information out in a timely manner. We're always getting emails from different health departments about different things that are happening in the world and in the country. And one of the things when we did the investigation for Sunday ABEC is they actually were testing items in the refugee camp in Egypt that the family had come from, because we were trying to cover every single possible you know, exposure type. So we're always looking for, you know, something new, unfortunately. And we're, you know, that's why it's important to test. But the brain is still developing, but the damage is really lifelong and impactful, especially in those early years. That's a very long answer, sorry. We'll right back there and then over.
You mentioned water testing, and I assume that New Hampshire's public water supply has been tested and found to be okay. What I'm wondering about is people who have wells, and if they have been tested, if there are certain areas where the wells show lead levels.
So that's a really good question. Most of my work is in Manchester proper. The city water supply, unlike some of these stories from Flint, Michigan, is very highly tested and regulated. The pH is controlled. A lot of the things that went horribly wrong in Michigan are very well maintained. Our water source is not a river, and it is the Lake Massabesic, which is an amazing, pristine body of water. Where we run into some issues is with old pipes and solder. So one of the things that, if I were to put out a message that said, one little thing that people could do in the morning before they make their coffee, their tea, mix their baby formula, is let the water run for a minute. I know that's wasteful, but when you have older housing, that lead solder, the lead, if it's stagnant, can gradually in very small amounts come out. Is it going to be detectable? Probably not, but hot water will allow for the lead to come out more than cold water. So we never want to use hot water for baby formula. I know it's convenient, or I don't want, it's going to take forever for my water to boil to make pasta, but do not use hot water for cooking, because the chances of it having any number of, you know, things that we don't want to come out of into solution could be an issue. With regard to lead occurring in well water, I haven't heard of that being like a geographic distribution like arsenic is. That is a definite, or radon, depending on what type of well you have. I suppose if you were near like a lead smelting facility, that maybe there might be some local effects. But well water is something that is not regulated, and if anybody does have a well, you know, you should have an annual bacterial test, a radon test, probably once every, I don't know, 5 to 10 years, and then arsenic would be on my bucket list, and you know, lead would probably be like a one-off, like do it upon it. That really shouldn't change. It's a good question. Well, this is a tough group.
I've been talking with you about this now for so long, and every time we talk about it, more things come up that you haven't said before.
Yeah, mine was about for expecting mothers.
Yep.
Let's say if they somehow are lead poisoned, or it just cannot be passed on to the fetus.
Yes, it can, unfortunately. And you know, when expectant moms are having their prenatal visits, and I've been to 3 sets of visits, there's just information galore getting bombarded, and so, you know, is the message about doing renovations, we want to get the room ready for the baby, and we're going to do this, and, you know, this is a message that is important for everybody to hear, because it's, you know, just the fact that we have older homes, you know, makes it germane to everyone.
You mentioned lead solder used in older homes as a risk. You lived in other parts of the country where there were lead lines from the street to the home.
Yeah.
Do we know if that exists in Manchester or other areas in New Hampshire?
Yeah, so that is a fact that is the case in many of these distribution systems. The key is to control the pH of the water so that the lead will not leach out, or it's minimal. So that is something that went horribly wrong in Flint, is they basically skimped on certain aspects of their treatment because they changed the source, which changed the condition of the water, and then that allowed for more of that process to happen. So that is something that could be an issue if you didn't properly you know, control the pH. And there's also some other additives that they use for corrosion prevention. I can't get into like the specifics because I'm not sure, but I know that those things are also monitored. And then there's also some issues when they do pipe flushing and relining that help to, you know, minimize that. Yeah, and then over here.
Because I was an educator, I'm wondering how many, is there a way, maybe there's no way to tell, like how many children have been permanently damaged. And I've kind of known that if somebody can't read and they feel excluded from society or can't get a job that's enough or something, and it also can lead to people being in prison. So I'm just trying to broaden the idea that this is like for the common good. I mean, this is like, it could be like very damaging for a lot of people. It's like, so I just really can't believe this is going on.
So I couldn't agree more, and there are some tools that some folks have developed that try to estimate societal cost, to your point. So I mean, this lead has been around for a very long time, and there are people who look at like a group of children and then try to look back and see if they were exposed to lead or possibly exposed to lead, and then what are their outcomes, which is a really difficult type of study to do. But the research is overwhelming, and this is from the late 1980s on, and then we're able to start doing cost-benefit analysis of if we were to reduce this or do this intervention, we can, you know, reduce the number of, you know, judicial encounters, and these are real impacts. So if I'm trying to make an argument that we should invest money to do window replacement, which is a really important facet of primary prevention, it's going to cost $10 billion, but I can say that if this many children are not going to be poisoned, and, you know, they're not going to be reliant on special education and all of these other, or law enforcement interaction and judicial system, like, you have to make a dollars and cents argument for some people, and that's some of what, you know, we will need to do to move the needle, so to speak. But you're absolutely right. The impacts are not always obvious, but it is the literature is very clear that if you were lead poisoned, you are X amount of times more likely to have behavior, societal challenges, encounters with law enforcement, etc.
I had a child, the one that sticks out in my mind is he couldn't even, like I had a board like a kid's game, and you have to hop, right? He couldn't do one-to-one correspondence. He was either hopping twice in the same spot or he was skipping one. I'm like, and then I had adults. I was for, I don't know, a few months at the Moore Center, and I had 3 different groups of adults. By the time I got to the 3rd group, oh my gosh, they couldn't even tell the difference between 2 apples and 10, like this is lesson. I mean, it's really sad. I saw so much sad stuff, but it's so, it's awful when the baby dies, but it's not just that. It's like a whole bunch of people getting affected for the rest of their life. I can't believe, we have to worry about realtors when this is happening. It's driving me crazy.
I have this stat that we have shared out along the way that for every dollar spent to reduce lead poisoning, there's a social return on investment between $17 and $21. So to use your example of
That's right out of our creed, if you will.
They did some research, I'm not sure it was just around the New York area, but they had developments right next to, not necessarily oil refineries, but these big gas stations, 50 trucks coming out once. And they did research about the brains of the children in that vicinity. So how did they ameliorate that? We have some unleaded gas, but what about the other gas?
Yeah, so that's a really good. There are newer emerging studies around diesel exhaust and particulates from combustion, whether it's highway corridors, and so the research is looking at are some groups of people disproportionately impacted by more pollution. And one of the tools that I use to generate some of my maps has different indicators about risk. So if you're right along the highway, you're going to have more of a burden, if you will, of particulates from that traffic corridor. Or if you live in a particular area where there's a lot of trains or whatever the case may be, we're able to look kind of at that scale and say, this type of pollution is impacting health. There's a ton of research on particles, or PM, and one of the things that we're working with in the community right now is deploying air monitors. So you may have heard of that, and we're going to be putting them out. And yeah, exactly. We've tried to geographically, map them out and get places that we could protect the monitors. And what we're going to be looking at is what's the variability across neighborhoods, and then ultimately, maybe it'd be my retirement job, we'll be looking at like hospital data or school absentee data where there are pockets of higher particulate impacts. So one of the really, I also teach, you could probably guess by the way I'm talking, is we look at studies from the 80s that talk about life expectancy and pollution, which now seems like, yeah, if you have a lot of, that's going to be a burden on your body. Well, then we could look at pollution and heart attacks and heart damage, and then we can look at pollution and other health indicators. So it's not just about life expectancy. We learn more over time. Unfortunately, as you all know, we're kind of our own experiment in a lot of ways, which is not a good thing. But we're learning more, and the science is helping us kind of detect things at lower levels. And if lead is no different, we know that the damage is happening at very low levels. And I'm at least pleased that we've recognized that almost to the detection limit of our tests, we need to be doing something. It's making sure that we get everybody screened. That's one leg of the stool. The education piece is the other leg of the stool, and then dealing with the hazards is the other kind of leg of the stool. And we have a role in our commission to provide recommendations for each of these parts. And so our commission is, elected officials, some members of city government, but we also have sort of, as I mentioned before, we need to have a pediatrician, we need to have community advocacy. So we have different groups and types of professionals and other stakeholders that we want, but we haven't formalized or finalized our list. By the end of our term, we are going to come up with a list of recommendations, and ultimately the Board of Mayor and Aldermen will be the ones that have to vote. And that's when we're gonna all get on a bus and you're all gonna show up downtown and you're gonna get mad as hell and you're not gonna take it anymore. No, you're gonna be respectful, because that we're lacking civility in society, not here, but in general. So we will provide the evidence, we will do what we need to do to share what we think collectively as part of this commission is the best practice, and the policymakers do what policymakers do, and we are part of that process.
I'm sorry.
Yeah.
I just wanted to know, so do you have some on the commission now? Because how many?
It's kind of a fluid, yeah, you want to talk about like Alderman Fajardo, I yield to you.
Hang on, I just was reviewing this before I got here. So there's a total of 13 members on the commission. And as Phil was saying, they're very specific in terms of the sort of representation. Right now, we have a health department official. You're looking at him. Yeah.
Referee official.
We have somebody from the Department of Planning and Community Development. We have somebody from our school district who is let me say this, these are all people who will be nominated so far. So nobody is technically officially on the commission just yet, but we've been very carefully, going around and looking for very specific people, and it hasn't been easy, but we're getting there. So there's a couple of people from the Board of Aldermen, myself and Alderman Pat Long. We have an opening right now for a healthcare provider, preferably, as Phil mentioned, a pediatrician, some focus in children's health. We have, that's been a tough one to find, even though you can imagine we have a lot of, we have a lot of pediatricians here, but we're looking for somebody who's optimally either from Manchester or at least practicing in Manchester. So if anybody knows of a healthcare provider, a pediatrician specifically with relevant experience, we definitely need nominations for that. We have a resident with lived experience, as Phil mentioned. We are looking right now for to finalize two types of property owners. One would be more of a landlord who owns below 6 units. And then we're looking for more of a property management that owns above, I'll have to look at my notes, but above a certain threshold where it's more of like they might have multiple buildings. So it's important to get both perspectives of kind of the individual mom and pop landlord, as we would say, as well as an organization in the city that does this as a business, and we certainly have a lot of those. So those are two categories that we're working on. We have a former lead risk assessor who worked in, he's retired now, but he worked going in and out of homes to assess for lead, as well as after renovations have been made, to go back and ensure that the work has been done according to the law. We have an environmental justice advocate, and we have an alternate member. So that alternate member can be anybody, but preferably we're looking for people who have, certainly some relevant experience or perspective. So that was a long list. I'm just going to quickly say the open positions that we have. Oh, I skipped one. I apologize. Hold on. We're looking for also a representative or designee of a nonprofit organization focused on children's health and or early childhood education. So this could be like an MSK Health or but any kind of more of an organizational perspective, as well as a pediatrician familiar with childhood lead poisoning or other qualified or credentialed healthcare provider. Hang on. So 2 healthcare providers, an individual and a nonprofit entity. And then we need landlords, smaller individual landlord as well as a property management company. And then that alternate role.
So what's the total of all that? Like,
There's 13.
if you had them all, I mean, all that you wanted, all the spots that you're trying to fill.
There's the 4 that I just mentioned. So the 2 healthcare providers. Sorry, that's 5. 2 healthcare providers, 2 landlords and or property management companies, and then that alternate position.
Who makes the nominations and to whom do they nominate?
Yeah, great question. So, right now, so eventually the nomination would go to the mayor. We've been asking people to provide more like a cover letter of interest and qualification versus just looking at a resume. It's more typical that people submit resumes, but in this case, we really want to understand what is an individual's qualification or interest. So that would go to the mayor's office, and I've been asking for myself to be CC'd, or you can just reach out to me directly and I can help facilitate the conversation. We kind of have a small working group that are trying to get the last of these positions filled. So,
Do you have somebody from the community? You want
yes,
somebody
we
with
do.
lived
Yeah,
experience?
with lived experience. That is, that's been filled. Let me see, I'm just
Is there information that, because we have some relationships with landlords, so we could reach out to landlords,
yeah,
but
that
is
would
there
be
information
great.
they could provide us so we can?
Yeah, if you, we put together kind of like an information sheet, which I could email out. So we have 8 of the 13 positions settled, 2 in progress, and 2 open plus the alternate. Trying to say this in a way that's memorable. Also, feel free to email me.
In our meetings, once we have an agenda and all of that, that'll have to be posted so that
Yeah.
everybody can see.
Yep,
more
exactly.
too in the public meetings and such.
Yeah, part of the reason why it was important to formalize a commission is that it then creates a scenario where it has to be public and there has to be record, and anybody can attend a meeting, anybody can go online and read minutes from previous meetings, everybody can and should be part of it who wants to be. Even if you're not a seated commissioner, I can imagine a scenario down the line where we start subcommittees, where we need volunteers, and so there's gonna be a lot of opportunity, and even if you don't get involved and you're just, wanting to watch, the public should have the opportunity to see in full, full transparency and with visibility what's going on with the commission.
I have one quick question for Phil. There's a lot of infrastructure funding from the federal government. Is there some of that the city is applying for to truly help with this issue? I guess the issue is, it'd be like changing the pipes or other ways.
Yeah, so I know Manchester Water Works, a lot of the Recovery Act money for infrastructure is around water, so that would include, redoing pipes. We don't see all of the infrastructure that's in the road, under the roads, and it's rather aged. So that's something that I know a lot of communities are doing. The city receives HUD money through a grant that pays for, I mentioned the grant loan program that the Planning and Community Development Office runs. So that's, I think they aim to do between roughly 100 to 150 units per year to do lead abatement. So that is an ongoing thing, and the city gets money to do that, and they also look to do sort of a healthy homes approach. So it's basically, to boil it down, if you're in someone's home and you see some other things that aren't related to lead, why would you not bring those forward and talk about, okay, the smoke detector isn't working, and maybe there's some pest control issues, and it's an opportunity. So it's not a myopic one issue approach. It's a more holistic approach. So there's some funds that are available, and we try to leverage those. And then as far as lead case management, if a child has an elevated lead level, then our nurses at the health department will be their case manager, and we can go out and do a site visit to look for lead hazards and help identify things that we can do in the short term to limit additional exposure and work with families. Talk about nutrition, which is a really important thing. If the body is craving iron and calcium, and the child's diet doesn't have iron and calcium, then it's going to absorb even more lead because it's looking for similar nutrient, well, no, not nutrients, elements. So these are things that we can do, and we do our best when those things are identified. So there's a lot of different things, but we try to work together to, make the most of those visits. And anytime one of our staff is out for any reason in a home and they identify anything that looks like a lead issue, it's like priority number one, for sure. Yeah.
When you showed the map, it wasn't clear to me, like, I didn't see a river. Like,
Yeah.
is there as much on the west side as the east side? Or-
Yeah, it was not the great, I have another map, and the idea is there are certain census tracts that have a lot of the older housing, and it really is a good chunk of the center city just areas, but also the triple deckers on the west side that were, those are all older housing stock built in the 1800s, because those were where families lived that worked in the mills, and it all makes sense in retrospect, but those are, that's the distribution. So those densely populated areas tend to be the ones with most of the rental unit housing, as opposed to condos and single-family homes. But that doesn't mean that single-family homes don't have lead. It's just that triple deckers, multi-families, there's just more units that could have lead, and that's why those areas tend to be darker. There's a higher percentage of units.
So maybe one more question, because we are coming up to our time, so.
I'll stay until you throw me out.
Yeah.
Yes, of course, please.
So our question is, what are some of the signs or symptoms that a child can actually show to actually, you can actually try to tell, that can be lead poisoning?
That is an amazing question. And the short answer is, it's very difficult to tell without a test. It could be a stomach ache, it could be a headache, and it could be nothing, or it could be something very serious. And that's why the blood test is very important. That's the only way to know for sure.
Would you recommend that all parents of young children be tested,
Any-
especially if they live in an older house?
Any child age 1 and 2, that is, and it's covered by insurance, it's covered by Medicaid, all of that, 1 and 2, and it's now a universal recommendation, but even before it was universal, just because of the age of our housing, that was a Manchester and some other communities that have the older housing stock, but does it always happen? If your doctor's office doesn't do it and you have to go to another lab, that's a barrier, because transportation could be an issue. So, if somebody has a concern and they can't get into their doctor's office, we will do it at the health department. So you can call the health department if you're worried about that. But we tell people, go to your medical home first, but if you have concerns, you can talk to our staff. And I did leave a couple of flyers up at the front table. I left, there's some in Spanish and some in English, that has a lot of information about lead, and then also to call us with questions.
Well, thank you. I hate to close the discussion, but I just want to thank Bill for joining us this evening and for such a wonderful breadth of information that we so much needed. So can we all clap for him? And I want to thank everyone who's here this evening. Thank everyone who's here this evening, and for the UU for sponsoring us, and all the volunteers with the tea and the greeters, and everyone really for being here. I want to just share one more announcement, which is that right now in the legislature there's a bill, SB 392, It says relative to lead paint hazard remediation, and this bill gives $3 million for 2 years, ending June 2025, to the Housing Finance Authority to fund the lead paint hazard reduction fund. So this money will basically help really reduce lead poisoning in New Hampshire. So I urge you to support the bill. It's already been heard in the Senate Finance Committee, and it's a bipartisan bill. So the only thing I would ask you to do is call your senators. So Donna Susie, Senator Donna Susie, Senator Lou DeSandro, and then Senator Keith Murphy. And I have some information here on how you can contact them. So again, so get more money because the money is running out this year, by the end of this year, or fiscal year of this year. So we need more money for, like Phil said, more testing and other ways to get rid of this problem. The other thing I would say, if you're interested in continuing to work on these issues around housing, lead, you can join GSOP. We have our Manchester chapter meetings every second Tuesday of the month at 6 o'clock. Sometimes we meet here, sometimes on Zoom. So check us out. And thank you all. Have a good night.
Thank you.